Good evening. This is All India Radio, Kohima. I'm Jonas Yandan with Evening News. The headlines. Revised guidelines issued by Centre to be followed in the second phase of lockdown comes into effect from today. 941 fresh confirmed cases of COVID-19 reported in the country in the last 24 hours. Designated COVID hospital NHAK all geared up to receive any COVID-19 patients. An equipment for setting up of biosafety lab 3 for Naga Hospital Kohima arrives. Revised guidelines issued by the Centre to be followed in the second phase of lockdown have come into effect from today. It has allowed certain relaxations in the notified services from 20th April in areas without hotspots. A series of directives have been put in place to ensure strict compliance of the lockdown. All workplaces shall have adequate arrangements for temperature screening. Sanitizers should be made available at convenient places. Every workplace shall have a gap of 1 hour between shifts. Lunch breaks should be staggered. Staff should be sitting at a distance of 1 meter apart to follow social distancing norms. Professionals above 65 years of age can work from home. People with pre-existing health conditions like diabetes, blood pressure, and kidney-related issues may be allowed to work from home. Parents of children below the age of 5 shall also be asked to work from home. Use of Arogya Setu mobile app should be encouraged for all employees. All organizations have been directed to sanitize workplaces between shifts. The guidelines have also prohibited meetings in large number. Health Ministry today said 325 districts in the country have no cases of COVID-19, while in 27 districts there had been no positive cases since last 14 days, and as many as 1,489 patients have recovered and discharged from hospitals. Briefing media in New Delhi today, an official from Health Ministry said a total of 941 fresh confirmed cases of COVID-19 have been reported in the last 24 hours. This has been taken the total number of patients to 12,380, while 414 patients have died so far. Naga Hospital Authority Kohima, NHAK, the designated COVID hospital, is all geared up to receive any COVID-19 patients. Briefing on the preparedness with media persons today, Public Information Officer of NHAK, Dr. Sentimeran Aunok, said a proper action plan has been brought out by the NHAK to combat and mitigate the COVID-19 pandemic within its establishment. In this, he said a structure of Emergency Operations Center having various subcommittees was set up for smooth functioning of activities during the operation. Dr. Aunok informed that 90% of the works for the COVID hospital, including training of health personnel from doctors to sweepers, have been conducted, while the remaining 10% will emphasize on mock drills, which began today, and it will continue on regular basis. He said the hospital is now currently running a skeletal service 24/7. However, the service will increase as per the number of COVID patients admitted to the wards. He said the hospital has the facilities of 20 ICU beds consisting of 9 ventilators, 23 beds for female wards and 44 beds for male wards, besides recreational lounge, healthcare workers ward, laundry service for patients, CCTV control room, and others. Dr. Aunok further informed that till now the hospital has received 2,055 PPEs, 1,100 N95 masks, 2,600 FFPAs, 12,300 triple-layered masks, 10 infrared thermometer, 1,000 pairs of sterilized gloves, and 11,700 non-sterile gloves, 1,180 bottles of hand sanitizers, and others. The much-awaited biosafety laboratory BSL equipment finally arrived at Dimapur today by a special flight of IAF C-17 Globe Master. The total consignment of 18 tons arrived from Mumbai with highly sophisticated equipments needed for BSL-3 to be installed at Naga Hospital Authority, Kohima. Along with equipment, the technical team also arrived to set up the lab. The next consignment for BSL-2 lab at Dimapur is expected to arrive soon. Chief Minister Nipirio, in a tweet, thanked the Indian Council of Medical Research for fulfilling the long-felt need to have testing facilities in the state. Rio added that work will begin immediately round the clock so that it is functional at the earliest. This news comes to you from All India Radio, Kohima. Congress leader Rahul Gandhi, in a virtual press conference today, said that the government should start random testing for handling the novel coronavirus. Gandhi also said the entire country has to fight the crisis unitedly and there is need to grant adequate resources to the states to help them deal with it in a fine manner. He also emphasized on the need of more powers to be given to the states in order to handle the COVID-19 situation. Gandhi said that the government should create two basic zones such as hotspot zone and non-hotspot zone and start testing aggressively for containing the corona epidemic. He emphasized the need to make food available for the poor and also come up with financial packages to help small and medium entrepreneurs to sustain these tough times. In Meghalaya, out of 216 tests conducted for COVID-19, 204 tests are negative, while 6 cases are positive and 1 case of death. The tests for COVID-19 were conducted at different locations since the state first reported its case on Monday evening. Meanwhile, Health and Family Welfare Minister NHAK informed that all the 6 people who tested positive are quarantined. Out of the 6, 5 are family members of the senior doctor who died of COVID-19, and 1 is the housemaid, and their health conditions are stable. Further, he said that there is no evidence to prove that a senior doctor who died of COVID-19 contracted the virus from his son-in-law. He said that they have taken 3 samples of the son-in-law and all of them have turned negative, adding that it is difficult to come to any conclusion how the senior doctor had contracted the virus. He added that the District Surveillance Committee are trying to trace out on the history how COVID-19 entered Shillong City. Ambulance owners and drivers of Muguchung District today expressed their grievances for not being provided with personal protective equipments, PPEs, and other protective items to tackle COVID-19 pandemic. In a letter addressed to the Deputy Commissioner Muguchung, it said they will not assist or attend any suspected COVID-19 cases without proper protective equipments. It also said 2 ambulance drivers are being quarantined after performing their duties and added that daily food and drinking water are being served from their respective homes. Further, it also showed the status of the drivers as to where they fit in for availing insurance policy as announced by the centre. Deputy Chief Minister and Minister in charge of COVID-19 for Wokha District, Y. Button, today visited Merabani, Marajur Sub-Centre in Pandari, primary health centres at Bhakti and England, and the community health centre at Sanis to oversee the preparedness for the containment of COVID-19 pandemic. He was accompanied by advisor and MLA Madan Yantan and Dr. Chamben Muri, DC Wokha Orentang Lota, and CMO Wokha Dr. Wontako Mujoy. During their visit, they interacted with the staff, village council members and public leaders to take stock of their needs and grievances for urgent redressal. The Deputy Chief Minister urged people inhabiting Assam and Merabani border to be extra cautious about the pandemic and also to remain vigilant and check movement of people across the border line. And now 20 news, here are the main points again. Revised guidelines issued by the centre to be followed in the second phase of lockdown comes into effect from today. 941 fresh confirmed cases of COVID-19 reported in the country in the last 24 hours. Designated COVID hospital, NHAK, all geared up to receive any COVID-19 patients. An equipment for setting up of Biosafety Lab 3 for Naga Hospital, Kohima arrives. That is all we have in this evening news bulletin. Good night.